Richard Busch here, and today we've got another installment of my video blog, which is actually hosted by the American Chiropractor magazine at theamericanchiropractor.com. Thank you very much for coming today. We brought another one of my staff members in. This is our newest staff member, or one of our newest staff members. Her name is Dr. Amy Holzer, and she's a new chiropractor in our office. So what we're going to do today, and one of the reasons that we brought you in, Dr. Holzer, is I'd like to get your perspective on some of the different things that you've seen in different practices that you've been in, and then kind of contrast those with some of the things that you've seen from a patient, not only patient handling, but just the steps in which we take with each particular patient to make sure that that they understand their care properly and everything else, and how that actually fits in. Can you give us a little bit of background on that?
Sure. Some of the other offices I've been in, they were pretty much just standard chiropractic offices. A lot of the patients weren't very compliant as far as staying on their treatment plan and getting well. The results they saw were kind of middle of the road. When they processed new patients, it was kind of on a case-by-case basis.
So they didn't really have any plan in place as far as, well, we have these patients coming in, they have similar problems, and this is how we're going to actually handle or process them through their care. Is that right?
Yeah, not that I could see.
Okay. The reason that we even bring that up is when we're talking about patients and we're talking about the way that a patient is treated all the way through their course of care, from the first phone call through their last treatment until they move on to a supportive care type of a program, is I believe it's for the patient's best interest for them to be treated in a specific manner to make sure that they're getting the proper information all the way along the way. A couple of video blogs ago, we talked about having the proper plan in place and making sure that you know how to manage that patient's care and manage that patient through the process of actually becoming a patient. Because when they call in and they come in to see you for an exam, that doesn't necessarily mean that they're going to be a patient. So can you give us a little bit of background or a little bit of an idea of what you've actually seen around here as far as the way that the patients respond to care, and the way that they follow through care, that type of thing?
Yeah, definitely. Here, the biggest thing I noticed was the patient compliance was through the roof. Great results. People knew what was expected of them, knew what to expect as far as their outcome of care. They get well, the attitude.
Why do you think that there's a difference?
From what I've seen, everything is taken care of the same. Everybody is processed the same way. There's really no case-by-case difference until you get into treatment. Everybody who starts does the same way. Right.
Well, I think probably the better way to say that is that each patient, from the time they call until their exam and everything else, is handled the same.
Right.
And then when we start talking about a treatment plan, we're dealing with different patients, so we have a different treatment program.
Exactly.
We have pretty much an idea of what needs to be done so that we can get the proper information to those patients. Would you agree with that?
Yes.
Because I'm a firm believer that the more information that you can get to the patient, all of a sudden it becomes a situation where you're actually imparting information to them and you're giving them the opportunity to make a decision between whether I want to take care or whether I don't want to take care. And in a lot of situations, I was talking with Jeremy the other day, and we were discussing the fact that there are a lot of not only chiropractors, but a lot of different doctors in different fields that feel that they actually need to sell a patient on a specific type of care. And when we discussed that, we decided that one of the reasons that we've been so successful in helping so many people is because we're not selling them anything. We're actually presenting information and allowing them to make the proper decision. And by doing that, they understand what's expected of them and what they can expect out of care. And I think that that's one of the reasons that we've had such a high degree of compliance around here, is because they know from beginning to end of care what's expected out of them and what they need to do along the way. So that's one of the reasons that I think that that's important. Now, as far as what you've seen from the standpoint of the way that the patients are responding, and you mentioned compliance earlier, can you give us a little bit more background on that?
They respond well to care. They, again, know what's expected. They see other people around them getting better. They believe they're going to get better, which is half the battle. They show up for their appointments, they do their treatments, they take their supplements, they do their exercises, and they know they're going to get better if they do those things. And so they continue to come and...
So basically everything that we're doing, and this is kind of a leading question, but I'm going to ask it anyway. When when you see the way that we're managing that patient's care all the way through, is it something that you can sit back and you can look at and say, man, everything that's being done here is being done from the standpoint of we want to make sure that we're doing the best thing for the patient, for the patient's best interest.
Yes, exactly.
Now, in relation to the other offices that you've worked at in the past, and some of the things that they may have been able to do different, do you think that that's something that their office would have benefited from?
Definitely.
So that if they had a plan, they might have been able to do a better job in making sure that the patients get well, and then along with that, they have a better outcome in the end. And, you know, obviously we're also talking about being just a successful business as a whole. Does that make sense?
Yes, definitely.
So anyway, if we take that even a step further, then would it make sense for any doctor's office out there that isn't involved in some type of a program that has a plan as far as for patient management from beginning to end, that it'd be a good idea for those doctors to actually see some type of a specialist in that area? Would you agree with that?
Oh, definitely.
And the reason I bring that up is because there are many different groups out there that actually do have different plans for doctors, and they can give you a better idea, a better understanding of what you need to do, how you need to impart information to patients, and just the whole patient management idea, which is going to help every doctor be more successful. This is just the way that we handle patients in my office. And, you know, again, there are a lot of different people out there, there are a lot of different groups out there that have their own take on what needs to be done. I would highly encourage any of the doctors that are watching right now, if you do have an interest in finding that, obviously you can search out different things on the internet. If you have any questions, you can also send them to me at info@allcashpractice.com. We do handle questions like that, and there are things that we can actually answer in future video blogs.